my name is Evan Sutton, and I'm going to tell you a little bit about Pseudomonas aeruginosa. Pseudomonas aeruginosa is a gram-negative bacterium commonly found in moist environments such as swimming pools, soil, distilled water, and even cleaning solutions. It is thought to be opportunistic because it rarely affects healthy individuals. This pathogen is primarily found in patients who are in the hospital or nursing home being treated for cystic fibrosis, diabetes, burns, those who have urinary catheters or feeding tubes, and those who are immunocompromised. It can be found in patients of all ages, but it's most commonly found in children with cystic fibrosis and older adults who have been hospitalized. Pseudomonas depends on intricate signaling pathways in order to colonize and create acute or chronic diseases. It yields many different proteins which allow it to bind to injured epithelial cells, invade, and destroy host tissue. It protects itself from a host immune system by producing a proteoglycan to surround itself. After colonization, the bacteria produces extracellular enzymes which aid in tissue invasion. It can then invade the bloodstream and produce systemic effects through endotoxins and exotoxins. In order to diagnose an individual with Pseudomonas, either a blood, urine, spinal fluid, or exudate sample must be taken, and Pseudomonas should be isolated from the sample. Like you saw in the picture previously, the sample will be a bluish-green color. Once an individual has been diagnosed with Pseudomonas, the treatment of 2 anti-Pseudomonals should begin immediately because of the aggressive nature of this bacteria. Those who have infected wounds may require drainage or debridement of the necrotic tissue and infection. Individuals who have a lung infection or cystic fibrosis will require a long-term inhaled antibiotic to decrease sputum colonization. Because Pseudomonas invades the body through injured epithelial cells, it can affect any part of the body, but most commonly it affects the lungs, skin, soft tissues, bones, joints, and urinary tract. When affecting the lungs, it can cause pneumonia, which can cause your patient to have trouble breathing. When it affects the skin or soft tissues, the wound may become greenish blue in color and may have a fishy or fruity odor, and may also become necrotic. When affecting the joints or the bones, it may lead to osteochondritis or osteomyelitis. When affecting the urinary tract, it can lead to a urinary tract infection, which may cause confusion in older adults. Treatment of local pseudomonal infections is usually normal with no complications. However, if infection occurs in the lungs, this has a higher mortality rate than any other site. And if sepsis occurs, this could be fatal. The type of treatment this patient may receive in physical therapy depends on where the infection has occurred. The best things that we can do for these patients is to keep them moving and active. For those with pneumonia, breathing exercises are essential to help get oxygen into their blood. If the skin or joints are affected, the patient will need range of motion to decrease the risk of contractures and to improve functional mobility. Bed mobility should be performed to decrease the chance of pressure sores. Elevation of the infected limb to decrease edema should be performed, and ambulation within the patient's room. The patient may also need high volt electrical stimulation for infected open wounds. Some things that the therapist should consider before treating a patient is that this patient should remain on isolation so they can't leave their room. So whatever exercises the therapist wants to give to this patient needs to remain in the room and on their bed so that the bacteria doesn't spread to other areas of the hospital and to other patients. The therapist should refer to the patient's past medical history for any precautions or contraindications to exercise before beginning treatment, because usually these patients are in the hospital due to something else other than just the Pseudomonas. The therapist should also know that Pseudomonas lives in moist areas in the healthcare setting and has been traced back to healthcare workers' hands and nails, and also in the sinks in the healthcare facility. So it's important to follow proper hand washing hygiene guidelines and to wear appropriate personal protective equipment to stop the spread of this bacteria to them and other patients. To conclude, Pseudomonas aeruginosa is a highly contagious and very common nosocomial-acquired infection. It infects individuals whose health has been compromised through injured epithelial cells and has different effects based on where the infection has occurred. It can be spread through contact with soil, water, and even healthcare workers' hands. Normally, this infection can be resolved with medication unless it has entered the bloodstream. We as therapists should know the importance of wearing gloves and washing your hands to prevent the spread of this bacteria. When treating a patient with Pseudomonas, we're really just treating what they were diagnosed with prior to being infected, but with more caution to not spread the infection. Thank you for listening.
Hi, my name is Sutton.